Welcome back to Psych Soulutions for part 2 in our chat about sleep. In part 1, we covered the connection between sleep and resilience, what sleep medicine experts say about how many hours adults aged 18 to 60 should be sleeping on a regular basis, 7 to 9 hours per night. We also looked at common causes of troubled sleeping. In today's video, I'd like to share some interventions and changes you can make to improve your sleep quality and duration. You can decide which ones seem reasonable and manageable in your current life situation. Occasionally when I discuss how important sleep is with patients, they return and tell me the pressure to sleep more made everything worse. So I remind them to make slow and gentle changes. No need to try everything all at once or be discouraged if you aren't suddenly sleeping better after several nights of trying them out. I'd also like to clarify, this is not official medical or psychiatric advice. I'll go over when it is time to seek consultation with a sleep medicine specialist or a psychiatrist for complaints of insomnia or feeling chronically unrested. So let's pull the mnemonic back up from part 1. This mnemonic helps me remember important questions to ask patients when discussing their sleep life. The S stands for symptoms. This reminds me to ask about other symptoms of mood changes, anxiety, daytime energy levels, snoring, and new stress. Sleep apnea often goes undiagnosed and untreated. Essentially, obstructive sleep apnea relates to anatomy. People in larger bodies are more at risk, but people in smaller bodies can also have neck and throat anatomy that contributes to obstruction of the airway during sleep. As the neck and throat tissues relax and close off the airway, oxygen levels drop during sleep, and this is unhealthy for all organ systems in the body. So what are the signs and symptoms of sleep apnea that you need to be aware of? Disrupted breathing, in which a person's respiration can become labored or even stop for up to a minute at a time. Excessive daytime sleepiness is a big complaint. Morning headaches, irritability, limited attention throughout the day, or difficulty thinking clearly. Snoring, including snoring that is especially loud and involves gasping, choking, or snoring that may cause a person to briefly wake up. A morning sore throat or dry mouth can often be correlated, and a frequent need to wake up to urinate. So if you or your partner, your bed partner, notice any of these symptoms, please schedule a sleep evaluation with a sleep medicine specialist. Treating obstructive sleep apnea properly can truly change a person's life. I also focus on potential missed mental health symptoms. Bipolar disorder causes disruption in sleep and is occasionally misdiagnosed as major depressive disorder. The distinction is important as they are treated very differently. Individuals with symptoms of depression often experience changes in sleep patterns as well. Trouble falling asleep or staying asleep, and early morning awakenings are common. Anxiety disorders can certainly contribute to troubled sleep through racing thoughts, ruminations, excessive worry, even late evening or early morning panic attacks. Chronic illness or undiagnosed medical conditions can cause issues too. Chronic pain, thyroid disease, glucose regulation, and hormonal changes are just a few examples. In all of these situations, it is important to seek out professional help. If you don't currently see a psychiatrist or therapist, ask your family physician for a potential referral. We did an earlier video on how to find good fit mental health professionals, and we will link this below. The L stands for loops and laments in the mnemonic. When we lay down at night, our minds can seem like a circus sometimes. Our thoughts race and seem random. We start to worry or think about something that happened years ago. This happens as a result of the brain's default network. These parts of the brain become active when we are doing passive activities, like trying to sleep. Stress and mental health symptoms can worsen worry and ruminations. So we attempt to manage this initially by giving the brain something simple and concrete to focus on. My grandmother always talked about counting sheep, but there are many variations of these exercises. Try imagining a whiteboard and visualize writing each letter of your full name, then erasing it and repeat until hopefully you drift off. Or visualize preparing your favorite meal, imagining each step in detail. You can also name your breaths, so slowly thinking the word in as you inhale and out as you exhale. You can try counting your breaths all the way to 10 and then repeating from 1. You can try working your way through the alphabet by naming animals with each letter: ant, bee, cat, dog, elephant, etc. No doubt your mind will resist these exercises at first. Your thoughts will float off and you will find yourself lost in thought again. Just gently redirect your attention back to these exercises as many times as you need. The goal is to give your brain very light and emotionally neutral tasks and keep repeating these until you fall asleep. Patients return to sessions reporting success with these tricks, so give them a try. Cognitive behavioral therapy for insomnia is also really helpful for these loops and laments, whether you use a free coaching app or schedule with a therapist. The first E in the mnemonic stands for environment. Do you have a supportive and comfortable mattress? Is it the right size? If you have chronic pain, testing out which mattresses feel the best is essential. Is the temperature ideal in your bedroom? Sleep medicine experts recommend between 60 and 70 degrees Fahrenheit. Cooler is generally more conducive to good sleep. Is the room dark enough? Consider investing in blackout curtains or blinds to prevent street lights from keeping you awake or early morning sunlight from waking you too early. Securing blankets or towels over windows is also helpful to test out the effects before making the investment. What about noise? Depending on where you live, this can vary. Planes, trains, street noise, neighbors, other family members, pets, all of these can be a barrier. So consider turning on a fan or investing in a noise machine for some white background noise. Noise reducing earplugs work well too. The second E in the mnemonic stands for exposures. Here we mean substances, meals, screens, and stressful situations. Certain substances have a stimulating effect: caffeine, nicotine, a few prescription medications, and of course illicit stimulants such as cocaine or methamphetamine. Over-the-counter decongestant medications can keep you awake at night as well. One doesn't necessarily need to give up caffeine right away to improve sleep, but try and cut off your coffee or soda or tea around lunchtime. It never fails when discussing caffeine with a patient. They will say, "But I can drink coffee and fall right to sleep," and I believe them. But the effects of caffeine prevent us from deeper levels of restorative sleep. So even though we might not be aware of these effects, they really do influence your sleep. If you drink caffeine all day, every day, just start by slowly reeling in your last caffeine source earlier and earlier, and see if you notice feeling more rested during the day. Tobacco products, vaping, e-cigs, all contain nicotine, which is stimulating to the brain. Nicotine withdrawal can also wake us up, so it is a bit tricky. Naturally, I'm going to suggest talking with your family physician about a smoking cessation program because smoking and its equivalents are really detrimental to all aspects of health. Alcohol consumption can interfere with quality sleep. It may cause drowsiness, and some individuals drink at night thinking it will help them sleep. But in reality, alcohol causes frequent wakenings and prevents deeper restorative levels of sleep. What about food intake in the hours before bedtime? I hear conflicting complaints from patients on this. If they go to bed too hungry, they wake up throughout the night. If they eat a late meal, they can't fall asleep easily, either due to indigestion or feeling somewhat energized. So I reviewed some studies and articles, and it seems that nocturnal meals, especially meals higher in fat content, consumed 30 to 60 minutes before bedtime, have negative effects on multiple parameters of sleep quality. I found a few studies that seem to suggest a carbohydrate-rich meal around 4 hours before bed seemed to positively affect sleep quality. So consider having your last meal 4 to 5 hours before bedtime, and if you need a snack, maybe try something lower in fat and see how it works for you. Okay, the big one, screens. Patients really dislike this part of the sleep hygiene conversation, and I personally do too. Sleep medicine experts, though, have consistently found that screens and media consumption lead to pre-sleep arousal. In one study I reviewed, binge watching was highly associated with negative impacts on sleep. The authors think this is due to pre-sleep arousal, as I mentioned. We get invested in characters and storylines, and our brains are overactive after the stimulation. An argument with your partner or an upsetting email or phone call has the same effect. So this is purely an individual decision. If you are really struggling with sleep and feeling rested during the day, no show or text or email is worth that sacrifice in the long term. So if you must binge watch, do it earlier in the day. Resist checking email or having upsetting conversations after dinner. And I realize this is not always possible. The P stands for practices. If you take away one suggestion from this video, let this be the one. Laying awake in bed trains your body and mind that bed is for being awake. Same with watching TV or reading in bed. Bedtime really should be for sex and sleep, and that's really it. In general, I ask my patients to get out of bed once they've laid there awake for 10 to 20 minutes. They can sit in a chair with low light on and read or meditate or listen to relaxing music and then lay back down. They repeat this process as many times as it takes and still get up at the same time each morning, regardless of how many hours they slept. This practice retrains the mind to associate the bed with sleep rather than wakefulness. There is also a practice called sleep restriction, which is hugely beneficial and often recommended by sleep medicine specialists. This involves tracking your actual sleep hours for 1 to 2 weeks and initially limiting yourself to slightly less time in bed while trying to maintain the same wake time each day. For example, if your tracked average duration of sleep was 6 hours, you initially limit yourself to 5 hours and 45 minutes total time spent in bed. Once you are sleeping the full time, then you can move your bedtime earlier by 15 to 20 minutes and keep the same wake-up time, and the process repeats. The point of this is to slowly increase the amount you are sleeping while also training your body and mind that laying down in bed equals a cue to sleep, not a cue to remain awake. If you work a night shift or swing shift, this can be a challenge. As mammals, we sleep according to cues from our environment, like sunrise and sunset. We follow a circadian rhythm, which influences hormones released from our brains in response to light and dark. Individuals who suffer from mood disorders tend to find these night or swing shifts more challenging, so it could be worth working with a professional. Occasionally, prescription medication or therapy is needed to relieve insomnia. Cognitive behavioral therapy for insomnia is an extremely effective and well-researched type of therapy. And although the sessions are limited to a few months, you will learn to work with your thoughts and behaviors surrounding sleep, which can benefit you for a lifetime. Your family physician can also refer you to a sleep medicine specialist if needed. I want to mention an app developed by the Department of Veteran Affairs using evidence-based cognitive behavioral therapy for insomnia. You can download this and start using it right away. It's like having a digital sleep coach right on your phone. Okay, phew, this will probably be my longest video so far. Please, if these suggested changes overwhelm you, remember to just choose 1 or 2 at first. Sleeping is a big problem for many people, and sleep hygiene is trial and error initially. I hope these videos on sleep and insomnia are helpful to you. If so, please like and subscribe for future videos. Rest well and sweet dreams.